I have been the speaker of the French Chiropractic Association for years, and I just enjoyed what I have been doing at that time on radio, on TV, and most of the time I was alone with the journalist, of course, either on TV or on radio, but sometimes I had to share the show with some other medical professions. I just love that because I think that it's an honor to have to speak for your profession, and I think that most of the time I received messages from people telling me, well, thank you for what you brought to us. We didn't know what was chiropractic, because in France, chiropractic now starts to be known, but before that, people didn't know too much what we were doing. So we had to say to these people on the show that while we are taking the human body in the globality, as a global system, and we are not just treating pain, but you are helping the body to cure itself if we give it the right and the good condition, the proper conditions. And that's why it was a discovery for many people, French people, you know, because now, since the beginning of the year, chiropractic is a recognized profession in my country, in our country, which is a big step. So it was a little by little, by these shows, by articles in the press, by speaking to people, meeting deputies or senators in our area, of course, all that put together, well, the time came where the profession should be recognized. And what I liked in National at my time, that we were learning for the first 3 years medical subjects. You know, for me, it's necessary to be a good chiropractor, to be able to do your own diagnosis, of course, to know exactly what is a patient, is this patient presenting, of course. So I think that we have to have a good medical basis first, and then after that we should be able, after having done our own diagnosis, of course, well, doing our different chiropractic techniques. That's why for me National is different, because it was really a scientific college to begin with, and now we are using still the diversified techniques, maybe AK, maybe some other techniques, protocols, of course. But I think that that's why the evolution of National is good, because I think that we can't just by the adjusting techniques take care of a patient completely now. Things have changed so much around, you know, the condition is completely different from 40 years ago. So I think that we need some help. Either we can bring this help into our studies, of course, and just use it, of course, or if we can't do that, using some other people, specialists, you know, as I told you before. But I think chiropractic should be, to survive, have a widened scope, a widened field. If we are just straight adjusting people, it seems to me to be a little short, you know, right now. When we are treating our patients in our country, in our offices, well, at the same time, in my mind, I say, well, you know, Jean-Robert, in Illinois right now, in Chicago, there is somebody doing exactly the same chiropractic adjustment you do right now. So you are just part of the universal, some type of universal community, you know, of people treating people, taking care of the people around, and I think we can be proud of who we are.